Hi, my name is Harry. Today I will be performing some upper limb SMR tests. The tests that will be conducted today will include the Brudzinski's test, Hermit's tests, Valsalva, Cody's, chest expansion, Ruse, and also Adson's test. In this orthopedic test, we'll be using the Brudzinski's test in order to determine whether or not there is any meningitis present. The way that we will perform this test, we'll have the patient lying supine facing upwards. The initial contact will be behind the head, and what we'll do is we'll get the patient to relax whilst we flex the head to end range, looking for any signs of movement at the hips or knees. Any positive sign may indicate meningeal irritation, nerve root involvement, or dural irritation. In this orthopedic test, we'll be testing the Lemaitre sign. The Lemaitre sign is used to determine any cervical myelopathy. What we'll have is we'll have the patient seated. What we're going to do initially is we're going to passively flex the patient's head whilst lifting their leg at the same time, gently, whilst their legs are straightened. Now, is there any pain or discomfort at all?
No.
No? So the Lemaitre sign with a positive indication would be pain. This would indicate multiple sclerosis, cervical myelopathy, stenosis, or any disc herniation that may occur. In this next orthopedic test, I'll be using the Valsalva maneuver in order to determine the effects of the increased pressure has on the spinal cord. The patient will be seated. What I'll do is I'll instruct the patient to lift their arms up to 90 degrees, make a fist, and then take a deep breath in, bear down as hard as you can. And what I'll do is I'll increase the pressure by putting a little bit of pressure into the abdominal area. Any pain or discomfort with that?
No.
Wonderful. So if there was a positive sign of pain, this would lead to the diagnosis of potential space-occupying lesions such as a disc herniation, a tumour, or any osteophytes that may occur. In this next orthopedic test, I'll be performing the Cody's test. This test is a shoulder abduction test, which is used to assess for cervical radiculopathy at the levels of the cervical spine of C4, C5, and C5 and C6. I have my patient seated. What I'm going to do is passively abduct their arm out, place their hand onto their head. Now, a positive Cody's sign would be a decrease in the relief of symptoms indicated at cervical extradural compression problems, such as like a herniated disc or nerve root compression at C4, C5, and C5 and C6. In this next orthopedic test, we'll be using a test called the chest expansion test. It is a thoracic spine examination procedure that checks for any reduction in the costovertebral joint motion, any ankylosing spondylitis, and any respiratory conditions that may be apparent. Now, what I've got for this test is I'll use a tape measure, and I'll have the patient standing. I'll get the patient to abduct their arms out, so lift your arms up for me, and I'll use the tape measure at about a T4 level. So now you can relax your arms. And what I'll ask you to do is take a deep breath in for me. And I'll take note of the measurement of that inhale and exhale for me. And I'll also take a note of the measurement of the exhale. In this next orthopedic test, I'll be testing Adson's test. This test is a provocative test used to examine the thoracic outlet syndrome. This is accompanied by the compression of the subclavian artery and by the cervical rib or tightened anterior and middle scalene muscles. What I've got is the patient seated, and what I'm going to do is palpate the radial pulse bilaterally. What I'll do is I'll extend the patient's arm, abduct and externally rotate the patient's arm. Okay. Then ask the patient to extend their neck. So I'll get you to extend your neck for me and rotate to this side. Now take a deep breath in and hold it. Now, if this test was to cause a reproduction in the patient's symptoms with disappearance of the radial pulse, this test would be positive for thoracic outlet syndrome. This test is also considered positive if the examiner detects a significant decrease in the strength or complete disappearance of the radial pulse while conducting the test. In this final orthopedic test, I'll be testing Ruse test, which is a shoulder examination used to diagnose thoracic outlet syndrome. I'll have the patient seated and I'll instruct the patient to abduct your shoulders out 90 degrees, externally rotate 90 degrees, okay, and then flex at the shoulders at 90 degrees, so make a fist. And what I'll get you to do is keep opening and closing your fist, so keep making fists, opening and closing repetitively over about 15 times. Now, if fatigue, cramping or tingling does occur during the test is positive for vascular insufficiency and thoracic outlet syndrome.